My name is Rebecca Seuss, and I'm an injection specialist and clinic owner here at the Refinery Skin Clinic.
My name is Michelle Lucasen. I'm a registered nurse, injection specialist here at the Refinery Skin Clinic.
We are going to be going over some of the most commonly asked questions on Botox that we found on the internet today. So stay tuned, this is going to be great. Really, is this what you guys are wondering about?
What celebrities are doing?
Is Botox dangerous? Scrape that off of there.
There we go.
Is it dangerous? No.
No.
Short answer, no. Here's the thing, is that Botox, we actually use it cosmetically, which we think about for lines and wrinkles in the face, but we also use it medicinally. So in all seriousness, Botox is also a therapeutic application. And what we use therapeutically is the exact same stuff that we use cosmetically. So is it dangerous? Absolutely not.
Is Botox painful to get?
I don't know, what do you think?
Overall, I do not think it is.
When we do our Botox treatments, we will give you a little bit of ice. We give you an ice pack. You can kind of hold it over the area right before we inject. So you're not going to feel really anything, maybe a little bit of a pinch. But
The ice pack really does help, just really calm everything down. And we use a tiny, tiny, tiny little needle. So it's very fast appointment, which is really nice. I think it's well worth it, that's for sure.
Yeah. What do we got right? Is Botox for rich celebrities? They'll never admit it, but yeah. But it's also for just normal people too, right? So if you've just been bothered by a little line or a crease or a wrinkle, I always say Botox is like getting your hair colored.
Yes.
Right? You see
Absolutely.
that first gray hair and you pop into your stylist and you ask for a little tint and she covers it up. Botox is the exact same way. You're always going to look like you. We're not going to change your appearance. You're just going to look refreshed and relaxed.
Love that answer. Wish more celebrities would say they'd
Admit it, right?
All right, is Botox permanent? Short answer, no.
We all wish it was. But what happens is when we talk about Botox, it's really the effects of Botox that last for about 3 to 4 months. So over time, your body is going to heal itself. You're going to start making new nerve endings that start moving the muscle again. So although I would love to say that we could come up with a really permanent fix for it, it's not. But it is something that you usually retreat about 4 times, or every 4 months. So about 3 to 4 times a year.
Yep, so it's more of a maintenance to kind of keep the results that you are looking for.
Yeah. Will Botox get rid of my wrinkles? This is your favorite question. Michelle loves it when people ask her this question.
So depending on lots of different things, but when it comes to Botox with fine lines and wrinkles, what it's going to do is soften the wrinkles. Nothing magically is going to 100% take away a wrinkle.
Oh, you mean Botox isn't spackle?
It doesn't.
Okay.
It's
Right.
not like the edited photos y'all see on Instagram and everything like that, where nobody has a wrinkle entirely on their face. I mean, I have wrinkles. You have wrinkles.
I have wrinkles.
The whole
So
point
many
is just
wrinkles.
to soften everything.
Right.
And that nice and natural look.
Will they ever go away, though?
Yes, but it's a maintenance.
Yeah.
So as we talked previously about keeping up that 3 to 4 times a year kind of thing, that's important because once that muscle contraction starts to come back and starts contracting again, that wrinkle's going to form. So if you do Botox once, it's never going to really soften that wrinkle and that fine line that you're looking for.
I always tell people if they have a line at rest, they're going to have a line after Botox. But keep doing your Botox, let that skin heal and remodel, and eventually it will go away. We've got some tips and tricks up our sleeves, too, to get it to go away a little bit faster if you need it to. Will Botox give me a... What do you think? Give me a frozen expressionless look. God, you wish. But no.
No, it actually won't at all.
It won't. People want it and they kind of think that that's what's going to happen, but the reality is you have hundreds of muscles in your face, hundreds of them. And we're literally working on maybe like 6 or 8. Yes. So our goal is always to make it so your eyebrows still go up and down, you know, they can still kind of frown in. Things are still going to wiggle, right? But don't make a crease or a line.
Well, and I think about it, I have 3 little kids. I mean, let's be honest, they're boys. I need them to see when I'm a little bit mad at them, right? So I want some type of movement. I just don't want the line there.
And as Mother Boys, she does need to be able to drop the hammer.
Yes.
There's no doubt.
And my husband. Don't tell him.
Ooh, don't tell him. It's just, it's just on video for everybody to see. I'm sure you can keep that a secret. No big deal.
All right, next one.
Will Botox make...
Ooh, that's a good question. Make my lines worse.
Yeah.
Answer's no. So as we talked about earlier, how softening the lines and wrinkles over time, right? So if you do Botox once and then you decide it's not for you and you never do it again, what's going to happen is that muscle's just going to wake back up and you're going to start to make that line again.
Totally.
So it will definitely not make anything worse.
No.
Odds are you're going to do it the first time and you're going to love it.
You're going to keep doing it.
I always tell my patients, you kind of drink the Kool-Aid. You'll love the results.
100%.
Yeah.
The only thing I will say is that, you can get used to seeing yourself wrinkle less or very, very smooth. And then if you stop doing Botox and you see those lines come back, you kind of forget, but you'll never go back to the way that you looked at baseline. No. So always take that first picture and then keep it in a special album just for you to go back and look at.
Yes.
Those are some good questions.
Yeah, I like that you said you don't go back to baseline because I've been doing Botox for almost 13 years or so. I've had multiple kids, multiple breaks. I started at 9. Yep, that's exactly it. No, but I took multiple breaks and everything, and I never went back to where I was in the beginning, even with taking some time off with children and multiple other things.
All right. These were good questions.
Very good questions.
Yeah. All right. Do we have our next board?
All right.
What you got?
Here we go. Can Botox be administered by anyone? Our favorite question. No.
It's important to, double check and see who's doing your Botox. I don't think it's a question, personally, I never get offended when somebody asks me about my credentialing, about my education, about, anything. Like, why am I doing what I'm doing?
Yes.
Yeah, I think it's great when they ask me. It's a great question.
Yes, absolutely.
Ask it.
It's very important. Very important.
It's fun to shop around and try to find low-priced Botox, and, I get it, but honestly, this is a medication that is being injected into your face. I
mean, it is your face. That's what I always say with consults. I always go over my education, why I'm in the industry, why I like it, and how many years I've been in the industry, and my credentials, like you've said. So it's very important.
What are your credentials now, Michelle?
My credentials, well, I'm an RN, so I'm a registered nurse, but I also recently in the last year passed a certified aesthetic nurse specialist. So a CAN certification is what it's called through the Plastic Surgical Nursing Board.
Yay, Michelle!
And she has it as well, and more.
Yes, but it's a big deal because it's a certification that is through the International Society for Plastic and Aesthetic Nurses, which is sponsored by the Plastic Surgery Nursing Certification Board. It's a whole lot of big words to basically say we nerd out over this stuff to the point where we study it in our leisure time and then take special tests just to get these special letters behind our names. But they are a big deal and they're not available to just anyone. So really, kind of do a little bit of digging as far as who your provider is. I think it's important.
Yeah, and I think we always like how you talked about, these are medications.
Totally.
So you really should be a licensed medical professional that's injecting it.
Correct.
So we do that here at the Refinery Skincare.
Yes, we do.
So, all right, next one.
We got, can Botox be as transformative as plastic surgery? No. So I'm very honest with our patients. We have a fantastic medical director, Dr. Chris Tolan. We'll give him a little plug because we're cool like that.
He's a facial plastic surgeon.
And, sometimes there are things that we can work with a needle. We can make them look a little bit better. We can improve you a little and just make you look fresh and rested. But really, if we need to truly lift the brow, Botox is going to get you there a little bit. But if you have true brow ptosis, heavy eyelids.
Also, neck, you always
those
get,
kinds of
we
things.
lose that elasticity and everything in our neck. So sometimes there's only so many things you can do when it comes to non-invasive injectables. Yeah. We always tell our patients, I'm very honest too, if they're looking for a plastic surgery result and I'm not able to give that to them, we're very honest. Yeah. And then we'll send you to a good referral.
Yeah,
and a good
we got a
surgeon.
guy. He's fantastic.
Yes.
We'll hook you up.
Next one.
Can Botox be reversed?
No.
So back to question 1.
Yes.
Make sure it's being administered by somebody who knows what they're doing.
Yes.
The good thing is, though, can it be reversed? No. But it's a very temporary result, right? The good and the bad thing about Botox. So after about 3 to 4 months or so, you'll start to notice that your Botox is gone, really, or right? We didn't
wearing
say
off.
The effects of Botox are diminished. And so, even if it didn't turn out the way you wanted it to, give it 4 weeks, 6 weeks, and you're going to start seeing things wake back up again. So,
Yep, so it's kind of that, as we talk about with Botox, that gradual onset for the medication to kick in, also that gradual offset for the medication.
Yeah.
So the good news is it's not permanent.
Nope.
But that's why you go see a licensed medical professional.
Totally.
Right. Last one here. Can Botox be preventative?
Yeah. Yeah, I think we're really seeing a change in aesthetics right now.
Yeah.
I've been in the industry for about 20 years and injecting for 12 of those. And honestly, when I first got started, most of my patients were probably in their 60s and their 70s, and I'm really starting to see a lot more patients that are coming in, and they're in their 30s.
Yes.
Michelle, I think
I'm
you
starting
even
to
see
a little bit more in the 20s as well.
Yeah.
A lot of it also plays with genetics too. I mean, just because you're 24, it doesn't mean you can't have a big line already here starting.
Yeah.
A lot of my clients and patients that I see that come in, they're like, my mom has this, it's starting. I have to get rid of it. So hence we're kind of starting it for preventative to correct that line from getting deeper and worse over time.
Oh, absolutely.
So there's definitely something to say to do it a little bit earlier and preventative.
And we talked earlier about how Botox doesn't take away a line or a wrinkle. So I always say the best wrinkle is the one that you never get. So if you start doing Botox before those lines are really deep, then you're going to just always look 25 or 30, even when you're a little bit older.
And I personally started in my 20s.
Yeah, right?
So I'm now mid-30s. So
And
I
you
don't really
don't
have the
look
lines.
like it.
So I'm
I
not
love
going to
it.
apologize ever for that.
This was fun.
This was really fun.
I really enjoyed this. You guys, thanks for kind of tuning in and finding out what your most common questions are. And I'm so glad that we were able to maybe dispel a few myths and answer some questions. Give us a call if any of this kind of made you want to check Botox out. Give us a call at the Refinery Skin Clinic or check out our website. You can securely text message us, or you can also schedule an appointment online. But we're always here to answer all of your questions.
Yes, a consult is always a great way to start.
Totally.
It's a complimentary consult, so we will have plenty of time to answer every question that you could possibly think of.
Thanks, guys. This was fun.